Physiotherapy is a very broad science, and physiotherapists have a wide range of skills that they bring to the table when treating patients. Physiotherapists have good ability to understand movement. They understand the pathology of disease and how that affects movement, and they have manual skills that they can use. They have skills in exercise prescription, and importantly they have a good understanding of pain. And pain, we understand, is on a continuum right from acute pain right to chronic pain, and we know that we've got to use the appropriate language with our patients in trying to move them forward.
As a physio, we have our 4 years of university training or a master's degree, and then we also, over every year, we do our professional development in different courses, and in the areas that we specialise, of course, we then do further training. And plus, on top of that, we work in multidisciplinary teams where we work with other health professionals, with the doctors, and so we liaise a lot with other people to help manage our clients' or patients' needs.
When people come to see us, the sort of things they can expect to have happen is initially a very thorough assessment and talking to them about what their goals are for the treatment, what's really important for them, what they want to get out of it. And then we put together a treatment plan, so whether that is using exercise or whether that's using a number of modalities, including manual therapy, and give them a bit of an understanding of how long this will take.
Physios see a wide range of different types of patients and also pathology groups. Injuries to the musculoskeletal assessment, your classic sprains and strains are the most obvious, and also working with different sporting teams, soft tissue injuries, joint-related pathology, and also fracture management. The presentation of a wide variety of different spinal pathologies is something that we treat very well, and also the management of chronic diseases using an appropriately prescribed exercise stimulus. More non-traditional areas include women's and men's health and continence, vestibular rehabilitation, and also physiotherapists working in a range of different occupational settings, treating work-related injuries.
Sports physiotherapy is a branch of physiotherapy that specialises in the assessment and management of injuries and musculoskeletal complaint related to sport and exercise. And that covers people that participate in weekend sport or basic levels of exercise right through to elite level athletes. As a sports physiotherapist, we undergo quite a bit of postgraduate training in courses that help us to develop the skills to treat sport-specific injuries appropriately and gain knowledge in up-to-date and evidence-based practice that help us understand the pathologies of sports-related injuries. So we most commonly deal with your usual sprains and strains like ligament strains and muscle tears or hamstring strains. We also see a lot of overuse syndromes and tendinopathies. We also deal with common impingement syndromes. So a standard consultation will usually involve a comprehensive musculoskeletal assessment, including sport-specific movements and an assessment of biomechanics. And treatment will often include a range of manual therapy techniques that might include soft tissue releases, manipulations or mobilisations, dry needling or taping techniques. And we also have a large focus on active rehabilitation or preventative exercise programs to help with game readiness and progression to return to sport. General practitioners can refer to us whenever they have a patient that has a musculoskeletal complaint or an injury that's a result of or related to participation in exercise or sport. For example, if you've got a netballer that plays socially or on the weekend and they've sprained their ankle, they might present with a sore swollen ankle, and that might be affecting their ability to walk and to get to work. And we're skilled and trained in being able to help that person get their ankle back functioning to a level that they can continue with their activities of daily life and get back into playing netball as soon as possible.
A GP would think of referring to a physiotherapist if they noticed that their patient was starting to shuffle or struggling to get out of a chair, like in the surgery, or whether they were declining in their abilities, whether they had a chest problem or a continence problem, or whether they had any ulcers on their legs, or a whole range of things might be a red flag for an older person.
Benefits we see for the people who attend our groups and our program is that first of all, mainly to reduce their fall risk, so we see them falling less. We improve their balance and their strength, and then also the confidence, which is so important, so that they can do things that they like to do and they're not so fearful of falling. And yeah, so it's what we do is that after we reassess all the clients, we actually feedback to the GPs so that they then can know what the progress is with the clients that we see.
The improvements that we've had with Parkinson's patients have been that often we're able to just get them getting out of their car better, getting out of a chair better, moving better in bed, getting out of bed better. But probably really importantly, a lot of Parkinson's patients disengage a little bit from society, which is quite stressful for their carers. So in a lot of cases we've been able to just engage them a little bit more and give them a little bit more hope in the management of their disease. We run a weekly class, and it's great to see a class, it's predominantly males with Parkinson's disease, you know, engaging and just enjoying doing the things that they need to do to stay strong.
Physiotherapists work closely with a range of different specialties. The preparation of patients prior to surgery is a really important component of their care. The workup for surgery will prepare a patient both physically and psychologically for their operation, but also as an inpatient, physiotherapists will treat patients, and also then in an outpatient setting, post-operative rehabilitation. There's a really clear continuum of care that's provided by physiotherapists.
Hand therapy is a specialty area of physiotherapy that involves the assessment and treatment of musculoskeletal injuries of the upper limb and hand. Hand therapists undergo postgraduate training and are members of the Australian Hand Therapy Association. Common conditions include carpal tunnel syndrome, overuse tendinopathies such as de Quervain syndrome, closed tendon injuries including mallet injury and rugby finger, and open tendon injuries including lacerations. A hand therapy session would involve a detailed assessment, an understanding of the biomechanics, an understanding of common and not so common hand conditions, and also surgical options that may be available for that patient. Treatment may include manual therapies, provision of appropriate exercise programs, and also the provision of a custom-made orthosis or splint. Early referral is best in hand therapy. This can prevent a seemingly innocuous injury developing into a much more complex problem. For example, someone with a radial fracture that develops into complex regional pain syndrome. You can refer to physiotherapists in a number of ways. You can do so with a private referral, through the Workers' Compensation Scheme, through DVA or EPC.
So one client we had here was referred by his GP because he was struggling to get out of a chair, and that can result in a whole cascade of problems, such as needing to wait for someone to help them to get out of a chair, which means they then do much less activity, which means they get weaker, increased falls risk, potentially could wet themselves if help doesn't come in time, so they are functionally incontinent, depression, social isolation. So this was a really good referral, and this gentleman had one quite old knee replacement and another knee that had very bad arthritis in it. He had inguinal hernias, he had depression, so there was a number of factors we needed to take into consideration with his treatment plan. But we were able to strengthen him really well. He was able to not only get out of a chair but could walk upstairs, and reported a few weeks later that he even managed to run for the bus. So the improvement in his spare capacity to meet those unexpected needs was really, really valuable.
If you're unsure whether someone requires physiotherapy or not, or if it's a more complex case and you'd like to discuss it with your physiotherapist, feel free to give us a call.